A lung abscess is defined as necrosis of the pulmonary parenchyma and formation of cavities containing necrotic tissue or purulent fluid, usually caused by microbial infection. Antibiotic management should be considered as soon as it is diagnosed, while awaiting confirmation of the causative organism. Must be continued for 4 to 6 weeks. Causes: aspiration of infected secretions or tissue from the mouth and upper respiratory tract in the unconscious or semi-conscious patient, for example in alcoholics, epileptics, anesthetized or dental patients. And also foreign body aspiration, for example inhaled peanuts, dentures, fishbone. And also inadequately treated bacterial pneumonia, especially gram-negative bacteria like Klebsiella pneumonia and beta hemolytic streptococci. Staphylococcus aureus causing multiple lung abscesses, penetrative lung injury, partial obstruction of an airway by tumor or lymph node, and septic emboli from other infected areas of the body. For example, right-sided bacterial endocarditis and bronchiectasis and infected bullae in chronic lung disease. So the symptoms are fever with swinging temperatures, cough productive of copious amounts of purulent foul-smelling sputum, hemoptysis, chest pain, breathlessness, easy fatigability. So the signs are fever, tachycardia, tachypnea, chest wall tenderness, dull percussion notes, diminished breath sounds, and increased vocal resonance. The investigations are FBC, sputum culture sensitivity, gram stain, sputum AFBs, chest X-ray. The main treatment objectives are to drain abscess collection, to treat underlying infection, to treat predisposing conditions. Non-pharmacological treatments, chest physiotherapy, improve nutritional status, ensure adequate fluid intake, and also surgical drainage of abscess. Pharmacological treatment, the first line treatment, you give clozacillin IV in adults, 500 milligrams 6 hourly for 4 weeks. In children 5 to 12 years, you give 250 milligrams 6 hourly for 2 to 4 weeks. And in children 1 to 5 years, you give 125 milligrams 6 hourly for 2 to 4 weeks. And less than a year, you give 62.5 milligrams 6 hourly for 2 to 4 weeks. And then you give amoxicillin plus clavulanic acid IV in adults, 1.2 gram 8 hourly for 4 weeks. In children 3 months to 18 years, you give 30 milligrams per kilogram 8 hourly, the maximum dosage of 1.2 gram 8 hourly. Less than 3 months, you give 30 milligrams per kilogram 12 hourly for 2 to 4 weeks. And then you give ceftriaxone IV in adults 2 grams daily for 4 weeks. And in children all ages, you give 50 to 75 milligrams per kilogram per day. You divided daily as 12 hourly doses for 4 weeks. Or you can give gentamicin IV in adults, 40 to 80 milligrams 8 hourly for 14 days. And in children 1 to 12 years, we give 2.5 milligrams per kilogram 8 hourly for 14 days. And less than a year, you give 2.5 milligrams per kilogram 12 hourly for 14 days. And also you give metronidazole IV in adults, 500 milligrams 8 hourly for 4 weeks. And in children 7.5 milligrams per kilogram 8 hourly for 4 weeks. Or You can give clindamycin IV in adults 300 to 600 milligrams 6 hourly for 4 weeks or until clinical improvements, and in children 3 to 6 milligrams per kilogram 6 hourly for 2 to 4 weeks. Continuation treatments: you give flucloxacillin oral in adults. You give 500 milligrams 6 hourly for 2 weeks. In children 5 to 12 years, you give 250 milligrams 6 hourly for 2 weeks. 1 to 5 years, 1 to 5 milligrams 6 hourly for 2 weeks. And less than a year, give 62.5 milligrams 6 hourly for 2 weeks. And then you give amoxicillin clavulanic acid oral in adults 1 gram 12 hourly for 14 to 21 days. And in children more than 12 years, you give 1 and 50125 tablets 12 hourly. 6 to 12 years, you give 5 milliliters of 457 suspension 12 hourly. And 1 to 6 years, you give 2.5 milliliters of 457 suspension 12 hourly. And 1 month to 1 year, you give 0.25 milliliters per kilogram body weight of 125/31 suspension 8 hourly. Less than 1 month, you give 0.25 milliliters per kilogram body weight of 125 per 31 suspension 8 hourly. And then you give clindamycin oral in adults 300 milligrams 6 hourly for 14 days. And in children more than 3 months, you give 15 to 40 milligrams per kilogram per day in 3 divided doses, with a minimum dose not less than 300 milligrams per day. Referral criteria: to refer to a specialist or higher level facility if there is no clinical improvement within the first 2 weeks of initiating antibiotic therapy.